I'm Julie Clark and I'm the matron for the birth centre here at Chesterfield and also the pregnancy assessment centre. Just under 3,000 women have their babies here at Chesterfield, so this video is designed just to show you the journey that a woman will take right from booking through to discharge back in the community. But that involves booking in the community midwifery bases, through to attending antenatal clinic, having their scans, coming on to the birth centre to actually have their baby, the postnatal ward, and then, as I say, finally back to discharge back into the care of the community midwives. My name is Michelle Murphy. I'm one of the core midwives in Antenatal Clinic. When a mum comes for her first visit, she will find Antenatal Clinic situated in the maternity unit, very close to the birth centre, very close to the pregnancy assessment centre and the postnatal ward, which is Trinity. They will all have an ultrasound scan. They will all be seen by a midwife. They will all be offered Down's risk screening at that visit, and they will all be offered a flu vaccination if that's what they like. If they're midwifery-led care, they will only see a midwife. If they are booked under a consultant, they will see one of the doctors that will be available in clinic. The partners can attend any visit if their partners want them to attend, and we try to involve them and give them as much information as they want. They have the opportunity to ask any questions, and if we don't know the answer, we will always find out for them. It is a very rewarding job. Yes, we've seen a lot of changes, a lot of different procedures come in, but it is a very good department. It's quite accessible. The ladies do have contact numbers for us, and we do have a good relationship with community and other departments.
My name's Helen Johnson. I'm the Community Midwifery Team Leader for the Chesterfield area. We moved into the Chesterfield Queen's Park Sports Centre of January this year. It's a new unit purpose-built for the midwives of Chesterfield to see their ladies from the Chesterfield GP localities. Our ladies here, when they're pregnant, they come for all their antenatal appointments, from booking throughout all the way through up until having baby, and then we also see the ladies postnatally after they've delivered. We do see them for some visits at home, but they can make appointments here, which is very convenient, so they're not waiting in all day for the midwife to come. Previous to the Queen's Park base being open, the ladies would have been seen at their own GP surgery, limiting the day that they can be seen, so that would be once a week. Now they can be seen Monday to Sunday, so there's more access to different times in the week for appointments. The ladies that come do have a set appointment, but if they need to be seen, they can make a quick phone call in the morning, and we can usually accommodate most ladies if they need to drop in on that day. The facilities at the new Queen's Park are absolutely excellent. We've got free car parking and ample car parking outside. They can also use the sports facilities while they're here. There's a lovely new cafe out there for them to sit and wait, or for going in afterwards. There's antenatal classes, so there's lots for them to do. The layout of the unit is we have a small reception area where our maternity assistant will greet the ladies. There's a small waiting area outside. If ladies prefer not to wait outside the door, we can direct them down to sit in the cafe while they're waiting for their appointments. Usually there are no long waiting times here. We've got 3 consulting rooms, so we can run 3 full clinics a day, which means we've got ability to see a lot of ladies and a lot of appointments. The centre's open from 8 o'clock in the morning until 4 o'clock in the afternoon every day, Monday to Sunday. And we are going to be starting a late night evening, open till 8 o'clock in the evening, once a week. That'll be on a Thursday. The ladies can ring at any time. There is a drop-in service if they need to come in. We can see both antenatal and postnatal ladies here, and if it's inconvenient for them at a certain time to see their midwife, we can accommodate them at different times of the day. The contact number for Chesterfield Midwifery Base is 01246 206161. Feedback so far, the ladies really like the unit, they like the flexibility of the appointments, and they like the ability to be able to use the sports facilities as well at the same time if they bring their other children down with them. So all feedback's been great so far from the ladies.
I'm Jane, work in Antenatal Clinic as a sonographer. Been here about 5 years, working with a small team of looking after women and their babies. We usually see women at about 12 weeks for the first scan, where they come for screening for Down syndrome if they want it. We check the babies then and look for different problems. We can't always see everything on scan, but we try our best to look the best we can. And then they usually come back around 20 weeks for a scan to look at baby structures. We allow one adult in with the mother because we're checking babies, so we need to concentrate quite a lot. These machines are quite new. We had them, I think it was last year. We also had a monitoring for the parents to watch, so they can look straight at the monitor, so that we're sat looking straight at the monitor as well, so we all get to see what we're looking at. It is rewarding. Difficult job, harder than people think, very physically demanding, more than you realise before you do it, but yeah, it's a rewarding job. Parents seem to appreciate what we do. See a range of emotions. Most people are really happy to see the baby. Some people just sit there and cry. We just try and make it as nice as we can for them. People are really excited to see the babies, and we do appreciate that.
Hello, my name's Gemma Sissons. I'm a midwife and I work at Chesterfield Royal. I've been a midwife for 8 years now, and I work on the labour ward, on Trinity ward, and on the pregnancy assessment unit. So the pregnancy assessment unit is where we see ladies during the pregnancy if they've got any concerns or worries, and we feel that they need to be seen. We'll do a telephone consultation. If we feel that they need to come in and be checked out, then they'll come to the pregnancy assessment unit. Anything from sort of 23 weeks and 6 days we see right up until you give birth. We undertake all sorts of different tests in the pregnancy assessment unit depending on what you come in with. So we do like a routine antenatal check on you. We check your blood pressure, feel what position your baby's lying in. We listen to your baby's heartbeat. We may have to do some blood tests. We check your blood pressure and we test your urine. And like I say, depending on what you come in with, we may have to do further tests like vaginal examinations if you come in and we need to assess that you're in labour or if your waters have gone. Sometimes we get ladies reviewed by the doctors if necessary. Once we've done all the tests on the mums, if we feel that they need to be admitted for closer observation, then they'll be admitted onto Trinity ward, or if they're in labour, then they'll be admitted onto the labour ward. All the midwives tend to rotate round to different areas within the hospital, so they'll work on Trinity ward for a period of time, then on the labour ward, and then they may go and do a few shifts on the pregnancy assessment unit, and that way it just keeps us all sort of up to date with our skills and makes the job a little bit more interesting when you're rotating around from area to area.
This new unit that was refurbished in 2010 is absolutely fabulous. It's very light, it's very airy, it's much more spacious, and the massive advantage I think is the ensuite facilities for women and their families. So it looks very welcoming, it's very secure, and as I say, it's very nice, bright and airy. All our birthing rooms here on the birth centre are en suite, so every woman and her family has the privilege of having private bath, toilet, shower, etc., which is really important for privacy and dignity. And also the midwifery-led care rooms, we've got a selection of different lighting so we can enhance the mood to keep things nice and low-key. All the documentation now is done on an electronic computer system which we call a K2 system. So what that does in effect is actually it makes the documentation and the recording of labours more concise, so it releases more time to actually spend with women and their families. We try to restrict visiting numbers to approximately 2, but do recognise that women are entitled to have, their birth partners, and sometimes that could be the partner and they also want the mum or the mother-in-law as well to be there. So we really try to be as flexible and accommodating as possible. But the reason we like to try and restrict visitors to 2 is just again for to try and keep things nice and calm and just to make it a really positive, calm experience for women. We do ask anybody, staff as well as visitors as well as patients, to hand gel before they come onto the birth centre and again when they leave. That's really important to prevent the spread of infection. We've got a lovely parents' room, just a sofa and a television. It's nice and quiet. She can spend some time in there with a partner. And that room's also used for visitors that come while they're just waiting to access their newborn grandchild. So for the midwifery-led end, we've got, as I say, the nice mood lighting, and we've got several rooms set up for active birth, so women can use the birthing balls, the couches, the bean bags, etc. And they really are promoting normal labour by adopting different positions. We've also got four birthing pools here at Chesterfield, which is really a really nice number, and they're utilised very well. So women may choose to have a birth in the pool, or they may alternatively just choose to use water therapy in the pool as a form of analgesia until they're in advanced labour. All women going through their labour, some may have additional concerns, and there's always a labour ward coordinator on duty, so the woman will be cared for by a midwife, but ultimately the labour ward coordinator will be in charge of the shift. So if any women, or their families for that matter, have any concerns, they just like a little bit of a more in-depth discussion, the coordinator is always available to deal with any issues that arise, as I am myself, so anybody's entitled to just ask for a little bit of a meeting if they just want a bit more information. For women that have had their babies and gone home, if they've got any concerns about labour, or they felt that they didn't really understand the process of labour or any outcomes, then we do offer a debriefing service. So women can contact the birth centre at any time. Usually it's a few months after the birth, and they will just go through their medical notes with them and explain any issues that they've got, clarify any points. And that's a really beneficial service. Women really find that they get a lot from that, and some women actually come back when they've had a subsequent pregnancy diagnosed, so it could be a few months to a few years when they come back for debriefing.
Call in progress.
I'm Sarah Petty, I'm the matron for Trinity ward. My role involves the day-to-day management of ward activity. Generally, once a mum has given birth on the birth centre and had time doing skin to skin and initiated the first feed, and obviously they've had the refreshments and they feel comfortable, then mums are transferred up to the postnatal ward, where we can implement a plan of care for mum and baby really, and give them the support and the care that they need postnatally, whether that's a mum who's had a normal birth with a baby that needs observations doing, and a mum who needs a lot of support with feeding, and a mum post cesarean section who obviously is going to need more support with post-op observations and pain relief. Yeah, we're very, very lucky to have a really nice environment. It's a very calm environment, and it just is very appealing really to the eye. I think a lot of mums, the feedback that we get is that we've got nice facilities. So obviously we've got 17 beds on our ward. We have reclining chairs for partners so they can sleep if they choose to stay overnight. Obviously they're not going to get a brilliant night's sleep, but the idea is that they're here to help and to support their partner. So we have got some really nice facilities on the ward for families. The best place for mum is at home. So as soon as a mum and baby are fit to go home, then we know that that is the best place for them to be. So women may choose to go home at 6 hours, and generally that's directly from the birth centre. Or after that, once they feel comfortable and confident with feeding, then generally they can be discharged home, as long as the midwife is happy that both mum and baby are fit to go home. So generally that varies between 6 to 24, 48 hours really, but all the evidence supports that getting a mum and baby that are well home is the best place for them.
My name is Annie Wilden-Lopez. I have been a midwife for 17 years at Chesterfield. I used to be attached to the birth centre, but I'm now a community midwife, and I have been for the last 8 years, I believe. We do some shifts on the birth centre, but of course our role mainly is out in the community, where we do home births as well. During the home visit, the general test that we go through is we check a mum's blood pressure, particularly in the first day. We check her pulse. We make sure that her breasts are comfortable if she's breastfeeding. If she's not breastfeeding, then we would go what anticipate in the early postnatal period as to how to make the milk dry up and that kind of thing. We would check her uterus, make sure that that's contracted. We also check her blood loss and make sure that she's not bleeding excessively. We also check her legs, we make sure that her waterworks are working okay, we check that her bowels are coming back to normal and that kind of thing. With the baby again, we do a head to toe examination and we just make sure that the baby's doing everything that we anticipate a baby to do. So we would check the baby's mouth, the baby's colour, the baby's tone, how many times the baby's feeding, what the baby's doing in its nappy, the baby's general behaviour, and then we also discuss the neonatal period with the mum as well as to what anticipate in the early days. Generally, I would see the same patients that I have seen in the antenatal period as I would in the postnatal period, and that's really nice because we've created that bond in the antenatal period. The beauty is that I'm seeing that period all the way throughout, so from early conception to now the baby being at home, and that's really nice.
When I was nearly 9 weeks pregnant, I gave Staveley Midwifery a ring. They took all my details over the phone. They booked a booking appointment for my first midwife check. So yeah, it was fairly straightforward. After that I went for the visit, met my midwife, and she went through the form, took all my details down, and then did the normal checks. So yeah, it was very friendly. Everyone was really friendly there and very straightforward. Oh, big difference. Yeah, it's much more accessible. You can just park up outside and walk straight upstairs. You get seen more or less straight away. The appointments work around you, so you know it's a lot easier. There's a few midwives there as well, so it's always, you can always ring them up at any time and have a chat to them. So it's a lot easier than going through the doctors all the time and booking appointments through the doctors. Yeah, I had a couple of ultrasound scans at Chesterfield Royal. Yeah, they were really good. Didn't have to wait long really. I did notice that when I was actually having the scan itself, you got a lot more time in there. There was a lot more different pictures, visual pictures. So on the monitor you had a stream of different pictures of the baby, which were lovely because you could see her at all different angles. She went through in a lot of detail what she was actually looking for. So you knew that everything was all right, especially at the 21-week scan when it's a lot more detailed. They went through everything, every single check of the baby. So it puts your mind at rest and you know everything's okay. The birth centre was all new and fresh. You walk in, it's lovely and bright. The really big rooms. While I was there, I used one of the birthing balls and I used the ensuite facilities. So it's a lot nicer. After giving birth, you can go straight in there after an hour or so, and you don't have to go traipsing down a corridor or anything like that. It's just there, so it's a lot more accessible, a lot easier. It's a lovely experience, a lot better experience than what it used to be, and especially with it all being new, it's a lot better. Everybody seemed really professional and really nice. They can't do enough for you, to be honest. Oh, Trinity ward's lovely. Again, they've totally redecorated. The beds are lovely. They've got chairs now for your partners, so they can actually sleep on the chairs and stay with you if they wanted to overnight. So it's a lot more comfortable. They've got toilets and shower facilities right next to you on the bays themselves, so everything's there at hand. The nurse's station is in the centre, so there's always somebody there you can go and get and talk to, and they're there for you all the time now, whereas before it wasn't. There was never anybody around all the time, but now they're always coming around doing your checks. They talk you through breastfeeding, and so they make sure you're comfortable before you even go home. They make sure you're fully prepared and you're ready to go, really. I felt very safe and secure on the birth centre and the Trinity ward. There's doors that are only accessible by pressing a buzzer, and you've got to say who you're coming to visit and who you are. So nobody can walk in and out as they please. So yeah, security is really high. You wouldn't feel unsafe at all. As a whole, all of the services throughout were very good, extremely good. Everyone was really friendly, really professional. Everything got covered. You always felt like you could ask any question at any time, like there was always somebody there to help you. So yeah, I was extremely happy with everything.
Hello, my name's Linda Gustad and I'm the Head of Midwifery here at Chesterfield Royal Hospital. I hope you've enjoyed the tour of our service, and I hope you'd agree with me that the facilities that we offer here are bright and modern and really fit for purpose. My role as the Head of Midwifery is to make sure all of the staff who work in the maternity service are trained and skilled and knowledge with all the care that we provide, so that we provide safe, first-class care to all women and their babies. We invest a lot of time and training for staff, and we provide a range of skills training, and we purchased recently a fabulous simulator for midwives to practice on. This training has enabled us to achieve a very high quality of care and enabled us to secure a number of awards recently related to the standard of maternity care that we provide. One of these is CNST level 2, and that's where we are assessed against a number of standards all related to clinical care. We've also very recently been awarded the Dignity and Care Award from Derbyshire County Council, and we're one of the only maternity services to have achieved that award. We also are a baby-friendly accredited hospital, which means that we support women who choose to breastfeed to successfully breastfeed, and we've invested a lot of training in our staff to enable them to support women who want to breastfeed. Thank you for watching. I hope you've enjoyed this, and we'd very much like you to choose our hospital in the future for when you have your baby. Thank you.